Imagine a health system with 90 primary care doctors, but only two of them actually treat ADHD. Those two suddenly look like they have practices overflowing with ADHD patients, not because they're overdiagnosing, but because the other 88 doctors aren't diagnosing it at all. This is one of the key points Dr. William Dodson explains in his recent Attitude Magazine webinar. Let's see what he says about these so-called hotspots of ADHD diagnosis, and then I'll take a more in-depth breakdown of what he says.
This whole notion about being overdiagnosed, there's no evidence for that. There are a couple of papers that show that there's small pockets around the country where prevalence, the number of prescriptions is much higher than the rest of the country. But in all cases, it's a rural physician who's the only person who diagnoses and treats ADHD. So that's what he hears. Everybody goes to him or her. And so he ends up writing more prescriptions.
In this webinar, Dr. William Dodson makes some important points. There's no evidence that ADHD is overdiagnosed. What looks like overdiagnosis in small areas of the country is usually just one or two physicians carrying the full load of diagnosing and treating ADHD, while most of their colleagues do not. Let's break down what this looks like in a real-world health system. Imagine a system with 90 primary care doctors. 88 doctors have about 2,000 patients each, the average patient load for a primary care practice. But two of the doctors have a mature practice with 3,500 patients each, and they are also doctors who are comfortable diagnosing and treating ADHD. In total, that's about 183,000 patients. With ADHD affecting roughly 10% of the population, that means 18,300 patients with ADHD in the system. Here's where things break down. So if those 88 doctors don't diagnose or treat ADHD, those patients are left undiagnosed, their symptoms dismissed or misattributed to anxiety, depression, or personality. So patients often struggle for years until they eventually find their way to the two doctors who are knowledgeable about ADHD. Instead of 10% of every doctor's practice having ADHD, the concentration of ADHD care falls onto just these two physicians. To an outside observer, it can look like those doctors are overdiagnosing, but in reality, the waiting rooms of the other 88 doctors are full of patients who were ignored or turned away elsewhere and who had to go searching for someone who would finally recognize what was going on. So what's the real question? Why are those two doctors diagnosing so many people with ADHD? Or why aren't the other 88 doctors diagnosing and treating ADHD when, as Dr. Dodson says, it's the second most common neuropsychiatric disorder after substance use disorder? So why don't more doctors treat ADHD? The studies point to several reasons. Lack of training. ADHD receives little emphasis in medical school or residency, especially in adults. There's a stigma and misconceptions. ADHD is still wrongly seen as a childhood disorder or just school struggles. There is some diagnostic complexity where symptoms may overlap with depression, anxiety, trauma, and sleep disorders. And without some training, it's easier to miss. And treatment barriers. The most effective medications are Schedule II controlled substances requiring stricter regulation and making physicians sometimes nervous about scrutiny. And there may be system pressures. With 15-minute primary care visits, it's easier to label a patient as anxious or depressed than to go through an ADHD evaluation. What research shows, ADHD is more often underdiagnosed, not overdiagnosed. Regional hotspots of diagnosis reflect access to at least one knowledgeable provider, but not inappropriate prescribing. And untreated ADHD leads to major costs, higher risk of job loss, car accidents, substance use, medical complications, and even reduced life expectancy. So what is a key takeaway? When you see that a few doctors have disproportionately higher rates of ADHD diagnosis, don't assume they're overdiagnosis. Instead ask, why are so many patients, especially in adults, being ignored by the majority of doctors? And why do they have to work so hard to find someone who understands ADHD? If you enjoyed this video, subscribe, hit the follow button, and share this with others. I'm Dr. Michael Lenz. Until next time.